Welcome to this class on Neuroscience of Human Movement. In this class, we will discuss other disorders of basal ganglia, that means disorders other than Parkinson's disease. So in this class, we will discuss specifically hyperkinetic disorders, in particular Huntington's disease and Basal, and other disorders such as dystonia, tardive dyskinesia, Sydenham's chorea, Wilson's disease and acidosis. Huntington's disease, right, is a genetic disorder, is a hereditary disorder and is autosomally dominant. That means what? If one of the parents has the disease, the child has a 50% chance of getting this disease, right. Fortunately, the gene responsible for causing this disease has been identified. This is the mutation of the Huntington gene in chromosome 4 that causes a higher number of trinucleotide repeats, right. The occurrence is about 5 to 10 per 100,000. So, 5 to 10 per 1 years, right. Symptoms are choreiform movements, dance like movements, choreiform dance like. So, this of course shares the root with what is called as choreography, right. So, like you see in movies, choreography means what? Dance, related to dance, right. So, choreiform dance like movements. So, these individuals, when they make movements, it looks as if they are dancing, right, and eye movements are abnormal, and usually this also is accompanied by other non-motor symptoms such as depression and impairment of cognitive function. Although the exact details of the non-motor functions or dysfunctions have not been understood, the motor form has been documented relatively well, right. And it turns out that in later stages of the disease, hypokinetic form, right, and akinesia and rigidity form, a phenotype involving rigidity and akinesia is developed, and that leads ultimately to death. Usually death happens after about 15 to 20 years after onset, right. And it turns out that the number of this trinucleotide repeat determines when the person is going to get the disease, right. If this number is below 35, this is relatively normal, and if it is greater than or equal to 36, there is a higher chance of early onset. Above 50, I mean this is just a ballpark number, above 50 repeats of this trinucleotide repeat usually signals that the person will develop what is called as juvenile Huntington's disease. That is what I have called as JHD, juvenile Huntington's disease. So, in some cases these children develop disease at around the age of 12, 13. So, very early onset disease. This is very different from the original discussion. This is very different from the original description made by Huntington in his paper, right. And it turns out that with generations, as the generations progress, the onset happens earlier. So, if in one generation the onset happens at 40 years, then in the next generation it turns out that the number of trinucleotide repeats increases. So, if the father gets the disease at around 40 years, the child has a chance of getting the disease at around 35, say for example, or 38, depending on the number of trinucleotide repeats. And in children with JHD, it turns out that there is an actual shrinkage of striatum and an enlargement of cerebellum. This is a maladaptation, this is an adaptation due to pathology. This leads to a situation where the person does not, this child does not go through the choreiform stage and directly reaches rigidity. So, in other words, people in whom the disease sets in at an early age, right, like in the case of juvenile Huntington's disease, it turns out that these people have a higher chance of directly going to the rigidity form without going through the choreiform, without going through the dance like chorea symptom of typical of this disease. Although the specific gene and the chromosome and the particular molecular details have been identified, still a lot of research is needed to further understand this. Let us remember that in comparison with Parkinson's disease, Huntington's disease and its pathophysiology are relatively poorly understood, right. Please do read the most recent article on this topic in Nature when Huntington's disease comes early, 30th May, which is just a few days ago, right, where the details of this is discussed, and there are a few other accompanying articles that I suggest you read, all right. So, what exactly is happening in this disease, what pathway is affected? It turns out that Huntington's disease involves selective degeneration of the indirect pathway. So, that means what? The neurons from the striatum to the GPE, right, are affected. This leads to a situation where the subthalamic nucleus is inhibited to a greater extent, thus diminishing the subthalamic nucleus input to GPI, right. Let us remember that the subthalamic nucleus actually is exciting the globus pallidus internal segment. That means, in the absence of the subthalamic nucleus excitation, the amount of inhibition, let us remember this is tonic and this is also tonic, right. So, this means a situation is developed in which the amount of inhibition that is received by the thalamocortical neurons is reduced. Because of this reason, what happens is that there is an increased excitation at the cortex level, right, leading to unwanted movements being performed, unwanted dance like choreiform movements being performed, right. However, this model is too simplistic. There are specific cases when this model cannot explain the actual details, right. So, let us remember that this model can only do so much justice. A lot more research is required for an actual deeper understanding of the pathophysiology of this disease. Then the case of hemiballism or ballism. If ballism happens in one side of the body, that is called as hemiballism. So, a unilateral form of ballism is called as hemiballism. This is happening usually due to a dysfunction of subthalamic nucleus of the basal ganglia. So, this means if for whatever reason the subthalamic nucleus is knocked out, then what happens is unwanted movements are produced. Why? Because the subthalamic nucleus is tonically exciting the GPI, right, in this picture. So, this is happening. So, this is a, so if the subthalamic nucleus is knocked out, that means what? That means the tonic excitation received by GPI, which is tonically inhibiting the thalamocortical neurons, is reduced. That means that the output of GPI is reduced, but the output of GPI is inhibitory in nature. Or ballism or hemiballism leads to a situation where there is going to be unwanted movements. So, the exact reasons why the subthalamic nucleus neurons are knocked out may be due to multiple reasons: metabolic abnormalities, stroke, whatever, brain injury, ALS, several causes, hyperglycemia, neoplasm, several causes could lead to selective degeneration or selective death of neurons in the subthalamic nucleus, right. What are the symptoms? The symptoms are flailing, ballistic and undesirable movements of the limbs. Usually what happens is that ballism and hemiballism involve violent out of phase movements between the shoulder girdle and the hip girdle, like you would see in Bollywood dance, right. When you watch a Bollywood song, what you see is that there is violent, that means very fast out of phase movements of the shoulder girdle and the hip girdle, right. This leads to a very violent and unwanted and very difficult disability for patients. Of course, in the movies this is fun to watch, but in the lives of people this is really horrible, because all the time they will have to be going through this, right, causes serious disability for the person who is affected by this particular disease, right. Why is this happening? Once again, due to death of neurons in the subthalamic nucleus. Then dystonia, this is an undesirable amount of muscle tone than required, right. So, this leads to a situation of abnormal posture and many times rigidity, right. So, why is this called? The hypothesis is that this is caused due to abnormal synaptic plasticity in the basal ganglia. Then the question is, how exactly is basal ganglia even implicated in this disease? Actually, some forms of dystonia respond to dopamine replacement therapy. Then the question is it somehow related to Parkinson's disease? In fact, the truth is that the exact link of how basal ganglia is linked to dystonia remains a mystery. We actually do not understand the pathophysiology or the connection between basal ganglia and dystonia. One particular form of dystonia is of course writer's cramp or focal dystonia, for example in musician related dystonia. This person can do practically everything using the same effector, but the moment he is going to perform a well practiced task, right. So, it is a task specific thing, a overly practiced task, then that movement is affected. This is called as musician's dystonia, right. Relatively rare condition, but a debilitating condition of this. Very poor understanding of why this happens, what are the details, how to treat this, what are the and the exact relationship to basal ganglia is also relatively poorly understood. Another disease is tardive dyskinesia, right. In this case what happens is there are involuntary and repetitive movements that are caused usually as a side effect of neuroleptic medications, right, and dopamine supersensitivity. So, in other words, that is upregulation of dopamine receptors, right. This leads to a situation where the person is frequently performing that kind of movements, grimacing, like that, like stretching out the tongue or smacking of the lips or various other unwanted and socially awkward movements, right. And one particular form of tardive dyskinesia is tardive dystonia, right. So, this is related to tardive dyskinesia and also related to dystonia, right. Again in this case there are involuntary movements of face and jaw muscles, again due to dopamine medication. Again it occurs more in women when compared with men, and it occurs more in older people when compared with younger people. In some cases it also happens as a result of other medication side effects, right. So, this is tardive dyskinesia. Then another disease is chorea, that are dance form movements or dance like movements related as after effect of rheumatic fever or post streptococcal autoimmune disease, right. So, this is named after Thomas Sydenham, right. It is a relatively temporary condition. So, fortunately it is a temporary condition. It affects striatal GABAergic neurons. It happens between the age of 5 and 15 years, right. What happens? What are the symptoms? Changes in handwriting, muscle weakness and unwanted or involuntary movements. Unfortunately, this is also accompanied by frequent loss of emotional control, right, as a after effect. So, after the person survives the streptococcal disease, then the person gets this disease. Then the so called hepatolenticular disease or Wilson's disease. This happens due to high deposition of copper in liver. Hepato means liver related, lenticular means basal ganglia related, right. So, this unwanted high deposition of copper in liver actually leads to a situation when the lentiform nucleus or the lenticular nucleus is and its performance is affected. Usually the age of occurrence is between 12 and 23 years. What happens? What are the symptoms? Difficulty in speaking, excessive salivation, unable to control salivation, ataxia, and unfortunately accompanied by mask like face. In other words, unable to express an emotion through facial features, right. So, facial features and expression of emotion through the face is associated with movements of relatively small muscles, as I mentioned in the previous class. So, this disease leads to a situation when the people are not able to move those muscles, when the person is showing a face that resembles a mask, showing no emotion.